Very thankful to the organizers for having asked me to be here today. Uh, what the organizers have in mind for this particular session uh, is something different. Uh, we are going to watch a video by Dr. Deborah Kestel, Chief of the Division of Mental Health, World Health Organization. And after that, it is about 20 minutes video, I'm told. Some of you have watched it already. Uh, and after that, whatever time is left, we'll have some discussion. Now, this video is important because this contains primarily the World Mental Health Report 2022. This report itself is important because it has come after 21 years. The previous one was in 2001. And it is important because it is not that just because it's coming after a very long period, but also because it is coming just after a pandemic, during a war, and during a sudden escalation of climate change. And I'm told that it is very illustrative graphics. Now, 50 years back, I was here in this institute as a first-year resident. Now, in this block behind me, we had an exhibition for the public of Chandigarh to tell them about mental health and an awareness exhibition. There was a poster on my table which said India has only 300 psychiatrists. And after that, the narrative somehow became like this, that we need to have more psychiatrists, many more psychiatrists, and once we have that, things are going to be fine. 50 years later, I'm told that we have 11 or 12,000 psychiatrists, which is 40 times. Of course, the population has also doubled. So 20 times. Has the access to treatment increased in that proportion or anywhere near that proportion? If not, why? Out of these 12,000 psychiatrists, 2/3 of them are in the private sector. The rest are in the public sector. So then this very important narrative came into being that psychiatry is too important to be left only to psychiatrists. So delegate. These people are capable, they're capable of learning things and treating on your behalf under supervision and so on and so forth. And there were other models, community health models, which was very promising, most of them, all of them actually on the drawing board state, on the experimental, at an experimental level. But somehow, when upscaled to a state or a country level, they met what Dr. Agarwal called as the centipede joke. So what goes wrong with? Now, question is that there is a hard barrier to accessing the treatment. We have plenty of psychiatrists who are sitting around waiting for patients. And we had a huge number of people wanting to see psychiatrists, but they are not meeting. There is a huge gap, and that gap is the paying capacity. Now, so what are the ways around that? So maybe let's watch this video, and maybe this has some answers to such and similar conundrums, and then let's hope that there is time left, and we'll carry this forward. Can we have that video, please?
Hello, good morning, good afternoon, good evening. My name is Devorah Kestel. I'm the director of the Department of Mental Health and Substance Use of the World Health Organization. And I couldn't make it to be there with you today, so thank you very much to the organizers for the opportunity to join you with this modality that we have probably gotten more used to, and so it is hopefully easier to follow up. I today will bring to your attention this discussion around why mental health policies are needed, why now, and what I'm trying to do is to share the screen so that you can see the presentation that I have prepared. I hope it works well. I'm going to base this chat on a report that we launched last year, but I'm going to focus on the case for public mental health policies. And we precisely came up with this idea of the report because we wanted to, in a way, spark a transformation in mental health that can benefit everyone and everywhere. And it was planned, it was the idea came after noticing perhaps that there were 21 years since the last report that WHO produced, a report like this. So it was time for an update. And even though we have a good action plan endorsed by our member states, progress towards the targets that have been agreed has been limited. And so the interest in mental health is growing, but we could see the challenges in seeing real change. So we needed to make this call for change. And the report precisely was written for decision makers and written in a way that you don't need to be a scientist to be able to understand, to follow, and to decide what actions are needed there. So the story is of the report is divided into chapters, but what is important, the message here is that we are explaining what is the issue that we are discussing about, what are the main knowledge, the main concepts and the knowledge that is needed in order to move on with this transformation. Then we also talk about the benefits of the transformation from different perspectives, and then the how, what are the different options, routes for the transformation according to what countries have done and the evidence that they have generated so far. So the idea that mental health is critically important for everyone, everywhere, is really central to this, to our understanding today, and that mental health is an integral part of our general health and well-being, but also a basic human right for all people. Having good mental health means that we are better able to connect, function, to cope, to thrive. We are better able to be who we are. And mental health also exists as a continuum, and this is something that comes again and again, sometimes as a confusion, sometimes as a real understanding. people with mental health conditions are more likely to experience lower levels of mental well-being, but this is not necessarily the case, or it's not always the case. How we experience each one of us mental health will change over time, and it will change in response to the conditions, the situation, the stress that we encounter. And also, it is important precisely for these external factors, how mental health is determined by a very complex interplay of individual, family, community, structural determinants that vary over time and depending on context, and that are experienced differently from person to person. Those determinants can serve as risks or protective factors for mental health. So we are exposed to both risk and protective factors throughout life. Those we encounter during childhood and adolescence are particularly influential, but at all ages, some are really key as risk of mental health conditions. For example, poverty, that increases the risk of mental health conditions and vice versa. Then some of the biggest threats to mental health today are economic downturns and social polarization, public health emergencies, humanitarian emergencies, and forced displacement, and the growing climate crisis. Unfortunately, all of those are happening at once in recent times. COVID is then the clear example of how the pandemic of a public health emergency have a huge impact on mental health and the stress people were exposed from the potential impacts of the virus, from the impacts of public health and social measures that were imposed to control it. And we saw some clear growth in the numbers of people affected by anxiety and depression during the first year of the pandemic. We are reviewing this data. But at the same time that those conditions were more present or increased, then we have a decreased number of services for people with mental health conditions. Services were decreased. Services, mental, neurological, and substance use services were used for purposes more closely related with COVID, etc. So there was a very important imbalance in 2022 that is not necessarily back to the point where it was before in terms of services availability, which were already short. So some of the data that I'm sure you're familiar with that we have used in the report, and we use here really a few figures as reference. One is related to the prevalence and how many people in the world are affected by mental disorder, and we name the disorders and the count. So right, we are talking about nearly 1 billion people affected. Most of them, many of them are young, and then we see that depression and anxiety are the most common, but also schizophrenia, which is the most impairing of all health conditions when in acute state, occurs to 24 million people. That's not a small number, it's 1 in 200 adults. And then the health impact of having a mental health disorder can be huge. We talk about the huge burden of mental and neurological and substance use diseases, and in terms of the years lived with disability, and the suicide, that is also an important indicator. 1 in 100 deaths globally are suicides, and the age of people dying by suicide is also a concern because it's young people as well. And the last figure that I think it is important to repeat over and over again is that people with severe mental health conditions die 10 to 20 years earlier than the general population, very frequently just because of neglecting their care. On top of this, then, there are some gaps, and the gaps are related with key issues. We are talking about the problem of not having enough information on mental health because data and research are both lacking. The number of countries with plans and policies on mental health has grown a lot in recent years, but still only around 20% of those are actually being implemented and complying with human rights standards. Mental health care is definitely under-resourced, and that was perhaps the main issue that provoked this idea of coming up with a report, because we see all this increased attention and we speak more about mental health, we hear more about mental health, but then when it comes to resources, only until the last data we have, only 2% of the healthcare budget goes to mental health. In low and middle income countries, most of that percentage, that those resources go to psychiatric hospitals, which do not serve the needs of the population at large. And the number of workers is also limited, dedicated to mental health. And so the consequences of all these, what we call for many years already the treatment gap is huge. We are talking about between 70 and 90% of people with mental health conditions not receiving any treatment at country level, and between 30 and 50% in high-income countries. So the 70 to 90 is in non-income countries. But in high-income countries, 30 to 50, I mean, they're huge numbers. And maybe here in this slide, you can see some of the reasons why those numbers are so high, and there are a number of barriers to this access to care. In part, this high unmet needs for mental health care is due to a lack of demand or a take of services, demand for services. Several factors stop people from seeking help for mental health conditions, including poor quality of services, as we were saying earlier, isolated institutions, highly stigmatizing institutions, but also the stigma and discrimination that is anyway related to mental health. In many places, formal mental health services simply do not exist, and even when they are available, they are all often inaccessible or unaffordable. And one of the biggest barriers is indeed stigma, no? That people with mental health conditions are commonly assumed to be lazy or weak or not intelligent enough or difficult people, and believe that they are violent or dangerous. And in fact, what we know is that they are more at risk of being victims of violence than the other way around. But still, these are important elements considered attached to people with mental health conditions that function as barrier to access to seek for care, to access for care services when available. The issue of stigma also creates conditions for human rights violations across different settings, and people with mental health conditions are frequently excluded from community life and denied basic rights. They are discriminated, as we were saying, but against a number of areas, employment, education, housing, etc., and the maltreatment can happen in institutions, but also at home, schools, etc. So there is a huge area of concern and field of work to advance on this aspect. The benefits of investing in mental health are also known. It can greatly reduce suffering and improve the health, quality of life, and functioning and life expectancy of people with mental health conditions, and a number of areas can be impacted because of the comorbidity, and so therefore the impact can be seen through other conditions such as NCDs or NTDs or HIV or TB. Oops, I went too fast ahead. Sorry. Okay. But also more concrete gain from intervening. I need to go a bit faster because my time is going short, becoming short. But then another reason then for investing in mental health is the social and economic development, and mental health is clearly linked to each one of the Sustainable Development Goals, and we can see intervening in different areas that could have an impact on the mental health, of course, of the people, but also on the communities that we are. Let me move forward to say that we have clear frameworks that countries have committed to move on and to advance on mental health, and this is what we need to keep in mind. What needs to happen in order for countries to follow up and move on those agreed frameworks. We have the knowledge, but between the expressed knowledge and the commitment, there is still work to do in terms of policies and plans that need to be there and need to be implemented, but then a budget that should be allocated to support the change that is needed. And we have opportunities because we have now huge advance on digital technologies, and there is a lot that can be done to reach out to many more than what used to be a few years ago. Some of the areas that should advance in order to move ahead with this agenda are related to promotion and prevention, and we recommend specific areas of prevention and interventions in terms of suicide prevention, working exclusively or focusing on children and adolescents, school, but not only, and also mental health at work, an area that definitely can prevent mental health issues to happen. But then one of the most important issues that countries have to commit to, and that's why the public health element is compelling, is that we need a different arrangement of services and support for people with mental health conditions. We need the engagement of the community with very clear responsibilities and roles, and within that we have what we call the bubbles and the three areas of services that are needed, the ones that are mental health services in general healthcare, in the area of comorbidities, as we showed earlier, but also the role of primary healthcare and general hospitals, and across the course, the life force, etc. Then there are the services that are specifically dedicated to mental health care and mental health, community-based mental health, that will cover a range of issues and areas, from mental health centers to psychosocial interventions, to peer support services, to accommodation, etc. And then we have the third area, that is what needs to happen outside of the health sector, and then those services beyond the health sector that could be in school, at work, justice system, etc. So all these needs to be taking place with different, according to the country realities, the priorities might change, but that are needed in order to make the change that is expected. To scale up care, there are a number of interventions that are available, ready for countries to simply grab and make them happen, right? From self-help initiatives to the task sharing with primary care, the non-health settings we mentioned before, integrating services with other conditions, the role of peers, etc. And also, as I just mentioned, beyond the health sector, the interventions that are related to employment, housing, education, etc. So, in a way, what we recommended in the report is to this path to transformation. When we say mental health, the case for a mental health policy now is because the conditions are there. What we have summarized in these last 20 minutes are things that we know, and many more also that you know, that we know, that is documented, that is based on evidence, and that we know will help a lot of more people to get the support they need to have their life as they deserve in the community they belong to. So what we need basically is to make sure that the evidence and experience and the expertise presented in this report is considered, and in order to, first of all, deepen value and commitment, we need to give to mental health an integral part of understand mental health as an integral part of our health and well-being, and mental health is important because it's important. That's it, because without it, we are not who we are. And so that should lead to deeper commitment, including then, or translated into also more resources. Then we need to strengthen mental health care. We need to make sure that the services briefly illustrated before are available and at the level and with the aptitude and variety that each context will allow, and with the specifics that each context will allow, but they are available. And then we also need to reshape environments. We need to make sure that the risk factors are less and that the protective factors are more, in a way that we create the conditions for people to have a better possibility to develop, to grow, to have life as needed, as research. So I thank you very much, and I invite you to read then the report where you will find most of these, the case for a mental health policy now better illustrated and presented. Thank you very much.